Hello everybody and welcome to the first of 2016's team brief. We've spent some time this afternoon considering a number of topics. First of all, I gave a brief update on the situation in the hospital and reflected on how we got on over Christmas and New Year. Then I spent a little bit of time reflecting on the decision made by our boards yesterday to proceed with the merger with the Royal Surrey County Hospital. And then Mark Hinchcliffe and Ace Tyndall talked through their new Be The Change app and, more importantly, the wider philosophy of using apps to stimulate thinking across the organisation around healthcare innovation. And finally, Giselle took some time out to have a conversation with team members about how effective our current methods of communication are, such as this message and others, and took some feedback from colleagues around what we could do to improve that. So I wanted to start by thanking all of you very, very much for the hard work and commitment that was very evident over the Christmas and New Year period. I know that an enormous amount of time and energy had gone into the planning within the hospital, but also working with our colleagues across North West Surrey, and it really made a big difference. I was in the hospital Christmas Day and in touch over the New Year period. And although we were busy and although we were challenged at times, we've come through that winter challenging Christmas period in relatively good shape. And really that's down to all of you and the hard work that you put into keeping the hospital in a good place and, importantly, looking after our patients and each other. So a really big thank you. Now, clearly, we continue to be under pressure. It's still the winter. Nationally, there's a lot of pressure on accident and emergency departments at the moment, and we're clearly seeing some of that. So I am aware of how hard you are all working. We keep talking to the team and others across the emergency care pathway around what we can do differently, how we can respond and support one another in meeting that challenge. But once again, a big thank you for taking such great care of all our patients every day. Many of you will have heard the big news of this week is that yesterday our board and the Royal Surrey County Hospitals Board have approved to proceed with the full business case that was presented for our proposed merger, and this is great news. Now, it's not the end of the story and it's not the final decision. A lot of work still needs to be done, and we will be working with all of you to develop the plans in greater detail. We've also got to engage with Monitor, the regulator, who will come and take a look at our plans and give us a risk assessment rating on whether or not they think those plans are fit for purpose and indeed whether there's any further work to be done. But in simple terms, this is a very big milestone on that journey, and certainly it signals a very clear intent to complete that process. Now, we are currently working towards a start date of summer 2016, and as I have said to you all before, whilst we're keen to get this done as quickly as possible and to limit the amount of time that people feel uncertain about what's going to happen, that may go out a little bit into the autumn, and we will keep you informed of how that happens. Now, of course, I understand you will all be wondering, what does that mean for you as individuals? What about your role in the organisation? What about the future? But also it will create a sense of opportunity and that the future's more secure. And I want you to think about those two things as you're reflecting on this decision. Please spend time with your managers. Please visit the website where there's more information. And of course, if you've got any concerns or you want to know what's going on, please come and ask me or see me anytime.
Hi, I'm Mark Hinchcliffe. I'm the Programme Office Manager, and we've been talking to Team Brief today about the use of mobile apps and mobile technology. So over the last couple of months, we've been trying to find new and innovative ways to get out and talk to more people about quality improvements. And at the same time, more and more people have been talking to us about developing mobile apps. So we decided to put the two things together. We've created our own app to support the quality improvement efforts in the Trust. It's called Be The Change, and you can download it from the Apple Store and the Android Store for your phones now. What we found is there are no guidelines currently for how to create apps for people in the organisation. So working with other colleagues in corporate services, we want to start creating those guidelines to make sure that people are making the best use of mobile technology, but doing it in a corporately responsible way. So we want to make sure that people are considering a few points if they're thinking about developing an app. It's really important that people consider that building an app is the right thing to do for their services and the people they're communicating with. People should really think about sustainability when building a new system to make sure it's not reliant on one person. You also want to make sure you think about information governance, and the main thing is to speak to the relevant people in the corporate services teams. It's the IT team, the communications, information governance, and really importantly the IT project team as well.
Hi, my name's Ace Tyndall, Senior IT Project Manager. If you think about creating an app, do come and see us within Health Informatics. We'll be able to help you with your business case, with the concept to conception itself, and also, as Mark has cited, helping you avoid those pitfalls, i.e. looking into the information governance implications and also ensuring that the application is also sustained.
Hello, I'm Giselle Rothwell. I'm the Head of Communications at the Trust. At team briefing today, I talked about the communications audit that we're doing across the Trust to find out what you think about the way we communicate. Are we using the right communication tools? Are you having the right information that you need to do your job? Is it interesting? And are there any other ways we can communicate and engage with you and your teams? It would be great if as many of you as possible filled in our survey. There's a Survey Monkey on TrustNet, or filled in one of the paper forms that hopefully you'll have seen around and about. Knowing what works for you will help us do a better job in the future, and particularly as we move towards merger with the Royal Surrey. Thank you.